America is home to 33 million small businesses, the beating heart of communities across the country.
And proof that the American dream is still alive.
This is a show about those dreamers and doers and the communities they serve.
Their real life stories.
Their struggles and successes.
Their grit, determination, and passion.
And the people who fight
to keep their American dream alive.
I'm Alfredo Ortiz.
I'm Elaine Parker.
And it's time for another episode of Main Street Matters,
America's small business megaphone.
Hi, everybody, and welcome to another episode of Main Street Matters. I'm Elaine Parker, the president of the Job Creators Network Foundation, and I'm so excited. We're joined today by Dr. Chad Savage, who's a great friend of Job Creators Network, also been a physician advocate for us. Dr. Savage founded Your Choice Direct Care to practice primary care with a clear focus on the patient and their health. Adopting the direct primary care model allows Dr. Savage to focus on his patients' needs without worrying about meeting meaningless requirements set by insurance companies and Medicare. Welcome to the show, Dr. Savage.
That's great to be here. Thanks for having me on.
Well, I'm so glad you were able to join us. You've worked with us for a lot of years on healthcare policy. Our campaign was called Healthcare for You. It was about putting patients first. It was about protecting the doctor-patient relationship, injecting more free market principles, choice and competition into our healthcare system. And people think, wait, you're going to have capitalism in healthcare? How does that work? But that's an important piece, right? And we'll talk about that. Tell us about your practice and direct primary care and how it works.
Well, it's funny that you mentioned that because people condescended with the concept of capitalism in healthcare as though we're somehow some unique industry. It works in every other industry, but there's something unique about healthcare in which it won't work. And there are complicating factors, but it is the best way to control costs and improve quality. That is the best economic system that has ever been created in the history of the world to do so. And our industry is no different on that. So in regards to my little branch of that in healthcare, the sad truth is in the United States, people think of the United States as a free market healthcare system, but it's anything but that. It's a top-down system, much as other countries. It's hidden in a morass of payment mechanisms, taxes, deferral of wages, direct costs, and et cetera, et cetera. So people are unaware that they are actually covering the cost of healthcare in the United States. What they've lost in that is they've lost any control over the price, and they've lost control over the decision making as well, because we're using surrogates, insurance company, and the government to pay for our healthcare. And the pricing in the United States is really bizarre. And I'm a little off topic from your question, but run with me for a second. So hopefully I'll come around to answer it. So the people understand that in countries like Canada and England and things of that sort, that the government is setting the prices, controlling the care, making the decisions for the patients. What they don't understand is the same exact thing is occurring in the United States, but just through a circuitous route. The AMA has a group called the Relative Value Committee that sets prices for medical care that is adopted with over 95% a rubber stamp by Congress to be the payment that Medicare issues to doctors and hospitals. What they don't understand is most quote unquote private payers, the insurance companies usually use that as a benchmark for their own payments. So there's 32 members on this panel at the AMA that set the prices for Medicare and Medicaid, which is a huge chunk of American healthcare now, and that the remaining chunk of healthcare that's usually paid by employers or directly by consumers are benchmarked to that. So that means 32 people are controlling the healthcare prices across the entire United States. Very much a Politburo type arrangement. So when people think we're free market pricing, we're not at all. Try to get a price on medical services in the United States. And it's very challenging to do. So what we really need is a robust free market so that patients control those assets. They don't subjugate themselves to these third-party decision makers, so they can shop on value, shop on cost, and make the life and death decisions for themselves, which is the most ethical location for that decision making to occur. Right now, it's occurring with these surrogates, and that's not ethical. So not to monologue too much, but people are trying to correct this. And I'm part of that movement. And one of the parts of that movement is what's called direct primary care. And where we work, we realize that one of the cheapest aspects of medical care that you really have no business paying through third parties is primary care. It's very inexpensive when you actually pay for it directly. And we're an example of that. In my own clinic, we work in a membership arrangement with our patients. So, and the prices are anywhere from $59 a month to $99 a month for unlimited medical care through our practice. We are not insurance. This is purely for the primary care. We're able to provide all of the office visits, telemedicine, if we do strep tests, flu swabs, injection of joints, if we do the provision of a biopsy, actually doing the biopsy, not the interpretation of the biopsy, et cetera, et cetera. And it's all wrapped into that predictable, budgetable, affordable cost. If right now you're paying through surrogates, you're paying the government or you're paying insurance companies to pay your primary care doctor. So you've lost control of that interaction. It's distorted the prices, and they are the ones who make those decisions for you. So our encouragement is have people retain those dollars for themselves, and there are actually mechanisms to do so. Don't cover that through insurance or through the government, and allow the patient to become the centerpiece of the healthcare system again, as they should be.
So I come to this not just educated on direct primary care, but I'm a consumer of direct primary care. And I left traditional insurance on my primary care because I was being told that I had to wait for a test. I have strong history of breast cancer in my family. I wanted additional screenings. My doctor said, well, insurance doesn't always pay for that. And, look, I'm fortunate enough that I said, well, I will pay for it out of pocket. It's worth it to me. I had lost my sister and my mother within 3 years of each other. And I said, I want additional screening. And so the doctor wrote as needed, which pushed me back 6 months. And that was it. But because of my experience working in healthcare policy, I knew about what direct primary care was. So I decided not just to talk the talk, I decided to walk the walk. And so I went and I interviewed a direct primary care doctor who I adore, and who has been amazing. She was able to get me all the tests that I needed, from the screenings to the genetic testing, you name it. And of course, she referred me out, walked me through the process. She was like my navigator, I would say, through the process of what I had to do for my own healthcare and to take control of it. And I can tell you the value of that and the empowerment is something that I wouldn't trade for anything. And it is like a membership. It's exactly like a membership organization. A gym membership, essentially. I mean, you mentioned $59 a month to $99. That's a gym membership. Yeah. And if I have a question for her, I had like a broken blood vessel in my eye one morning. I woke up and I was like, wow, that is the scariest thing. It's so scary to see that on your eye. And of course I had to go on camera too. So it was a little embarrassing, but I took a picture of my eye. I sent it to her through the messaging system. And I said, do you need to see me like in 20 minutes? Or is this something that we can just sit back and relax about? And she said, calm down. Here's what you need to do. And it was fine. I wouldn't trade that for anything. I mean, it's worth every penny. But how do we get Americans to understand we pay to change our own oil on our car? We pay to buy tires. We pay to change the brakes. How do we get Americans to understand that to be in control, we have to be the consumer? And when you have insurance companies and the government in between us and our doctors, we are not the ultimate consumers.
Well, you have a great example there personally, and I'm glad you were able to overcome the fear of bedhead on camera to be able to talk to your doctor. So, it is funny how people are totally terrified to sometimes go on camera, but that's one that is zero risk from subconjunctival heme is what you likely had. And yet your doctor was likely able in a very short period of time to allay your fears. And there's a huge value in that. I've had people who use our service and travel around the nation. I had a guy who was in Alaska. I mean, he's really utilized this to the maximum. He is suffering from the healthcare consequences of a wonderful lifestyle because he's been able to liberalize his life so much not being geographically locked to his doctors. He was in the middle of Alaska, started having palpitations, which is just a fancy way of saying his heart was racing. And he contacted me. He was like 2 hours from the nearest hospital. And he's like, do I make that trip? And I was able to reassure him that, yes, in fact, I'm sorry. I know this disrupts your vacation. This is a hike. But he was able to go there, and they did find that he was in AFib with RVR, which is a dangerous condition, and he was able to get it treated. He admitted to me later that he probably would have never even contacted his doctor and may have waited days to hear back, even if he had he been in the traditional system, because they have to pay for that. And that makes sense because, you want the doctor's time needs to be valued too. So the beauty of a membership model is that doctor's time is valued in the membership. So whether we're seeing someone directly face-to-face in the office, if it's appropriate, whether we're giving them care via telemedicine, whether they're texting, emailing, whatever, it's all the same to us because our time has already been valued. So we don't feel like we're being cheated as physicians. Many talk to doctors in the healthcare system. They're starting to pull back on payment for telemedicine, which is it took forever to get it paid. It took the COVID pandemic to get it recognized. Now they're pulling back. It's not being recognized again. So that's going away. People are losing that access. So doctors become bitter if they're answering a ton of uncompensated emails, text messages, video conferencing, and the like. And yet the patient feels ripped off if they're mandated they physically come to the office when it's not necessary just to pay the copay so that doctor's time can be compensated. So this is a wonderful model that blends those two, where both are able to access the adequate compensation and access to care in an affordable way. And the reason why is because we're accountable in the end to our patient. If we're trying to have exploitative pricing, if we're not giving a service that patient deems valuable for the money, they can fire us. And it always strikes doctors when I say that's a good thing. The patients should be able to fire you because that's how it keeps us accountable. That is stress, right? But it's a stress. It's a good stress. It's a stress that gets us up in the morning when we get that text to try to respond to it quickly. You get that phone call, you try to be on time for your office visits, give them quality of care, because the end determinant of the value of that transaction is the consumer, in this case, the patient.
And I think that's important that Americans understand that we are consumers of healthcare. It's not about going to Target and going shopping for products there. It is about being a consumer and being an educated consumer. And the only way we can be educated when we're consuming healthcare and when we're buying healthcare is if we know what it costs. That's it. And we have to know what it costs. And it's impossible you cannot call your local hospital and say, hey, how much would it cost me for a room tonight? It's not going to happen. They don't even know the cost themselves. They don't know the pricing. And so I don't know how you unwind where we are other than we start to educate Americans so that they make the choice to abandon the insurance system that we currently have, that we are tied to. Now, the problem with that is that most of us get our insurance through our employer. And that keeps us kind of chained to it, really. But it also makes it so that we don't care what the healthcare costs, right? Because we're not paying the bill. What we're paying is our monthly premium. And once we pay that premium and our copay, if we have one, when we go to the doctor, we don't care what the visit was. We don't care what the prescription costs. We don't care about any of those things because we're not the ultimate consumer. And that's what I think Americans just don't understand.
Yeah, I'd actually argue it creates a perverse incentive to overutilize because you've paid this money in and now you want to maximize every dollar out. So they want that you actually feel if you get a test and it's crazy overpriced, you feel internally as though, wow, look at that. I'm gonna get this. I'm gonna stick it to this company that's exploiting me every month. What's shocking is that we even call it health insurance, because insurance is purely a financial tool. It's a hedge against rare catastrophic financial loss. That is not what it is in healthcare. We're paying for every urinalysis, every ticky-tack expense with this. It's more akin to prepaid medical, and when you have that, you tend to want to overutilize it. And in fact, the insurers themselves are incentivized to keep the prices high because there's something called medical loss ratio. where under ACA or Obamacare, insurance companies were allowed to keep 20% of the cost of the premium from themselves. 80% has to go to medical payments. And so are they incentivized to truly decrease medical costs in that arrangement? The answer is no. Because if they're able to, if some new advancement that really dramatically decreased medical costs, like direct primary care, and you can charge in the traditional system $1 million a year, you can collect 20% of that as the insurance company. So you're collecting $200,000 for your own costs. Well, if that medical cost was decreased drastically to $100,000, now they're only collecting 20% of $100,000 or $20,000. They actually greatly harm themselves by it truly becoming more cost effective. So they talk out of both sides of their mouth. On one side, they say we're trying to make things more cost effective, but in truth, if they do so, it harms themselves and it harms their business model. So the good news is there are ways around this. There are options to start injecting free markets, HSAs, FSAs, and probably the least utilized, which is really a great option for Medicare, MSA, medical savings accounts, are patient-controlled funds where they directly contract with their doctors, care providers, imaging centers, and the like. So in the MSA, for example, Medicare actually funds it. They fund an account and they connect it to a high deductible Medicare product. So they may give, this is just an example, I'm not actually quoting a policy, but they may have something like a $3,000 deductible, but Medicare gives them $2,500. So it's akin, so that little bit of gap there is akin to the gap that many of them already have, or co-payments already have. So they can pay for that first $2,000, $2,500, whatever, out of that Medicare funded account, and they can add to it with their own funds if they want. But if they rationally consume that, and they have money left over in that account for the next year, they may have $5,000 in that account because they didn't utilize much of the first year. That rolls over. So now they're paying nothing and they're actually building a fund of wealth. And if there was a way to make that inheritable, they would have reason to rationally consume that to the moment of death, and potentially giving it to the heirs. And they wouldn't be they would be incentivized to use it rationally. Again, shopping for price, shopping for quality, and this is an important point, what they deem quality. Because right now, quality is assessed by the payer, which is the insurance company or the government. And what they deem quality may not be what you deem quality. For example, doctors for a long time have been subject to what's called high-tech utilization rating. They basically measure how many MRIs they order. And if they order too many, regardless of the appropriate indication of whether these are good tests to order in that situation or not, they can get dinged for having simply ordered too many compared to some random benchmark of people in the same field. Well, if you're a family doc, for example, and you happen to also be the team doctor for your local high school, it's very probable if you're doing, the team doctor for their football team, you're going to probably order more MRIs than the family doctor who's not doing that. They could all be 100% appropriate, and yet that doctor is now financially dinged because they're rated as poor quality because they order too many MRIs, and they're not only paid less for that patient, but they're reimbursed less for every single patient they see. That's a horrendous conflict of interest intentionally injected into the system between that doctor and the patient by the quality metric of that insurance company. So the quality really should be determined by the end user, which is the patient. And people know it. You say, how do you measure quality? People know it. They go to see the doctor. That doctor took the time with me. He, thoroughly listened to my problems. He addressed it. I came back feeling better. They usually have a very good subjective sense of quality. It's very hard to measure. And one of the things they can't measure is the quality of that doctor-patient relationship, which we know is important for compliance with medication regimens, for coming in and seeing that, for health. People who have a really good doctor-patient relationship are healthier people. However, how do you quantify that? Insurance companies can't do that. So they value it at zero. So because they can't quantify the doctor-patient relationship, and yet it's a major component of that healthcare relationship, that patient who's paying directly for their care is able to quantify it in themselves and know whether that's a worthwhile physician to see or not.
Obamacare, the Affordable Care Act, whatever you want to call it, our founder, Bernie Marcus, used to always not want to call it the Affordable Care Act. And he only wanted to call it Obamacare. And he said, why do I want to call it the Affordable Care Act? It's not affordable for anybody. But what are some of the, it's been with us now for over 10 years, maybe 13 years at this point. What are some of the most damaging aspects of Obamacare? And let's start with the premise that we didn't have a perfect healthcare system to
Yeah.
begin with. We had a broken healthcare system first.
Well, I'm getting to be an older doctor, and in the 2000s, I started in the early 2000s, so I have the blessing and the curse of having gone through that change in healthcare, and it was broken at that time. There's no doubt about it. And I recently did a lecture going back to 1942 in the Stabilization Act when it got linked to employment, et cetera, when it went wrong. But it went on steroids with Obamacare. What went wrong, and we warned at that time. You were injecting a lot of bureaucratic process into healthcare. Well, where does that time come from? Doctors are now spending more time documenting visits than actually spending time with the patient in the visit. They actually showed that it worsened very substantially between around 2010 to 2014, with doctors losing about 20% of their ability to see patients. But if you think about what's 20% reduction in patient volume, that's an entire day of a 5-day work week gone. So maybe you've gone from 5 days of work to 4, essentially, but not because they actually aren't working, because it's lost in bureaucratic waste. Well, we already had a doctor shortage, and it was projected to increase prior to Obamacare. When Obamacare came in, it chased doctors out because they lost that, connection with their patients, or running room to room. That's part of the wonderful aspect of being a doctor, is that interpersonal relationship you have with your patients. Well, that was stripped out. So now these doctors are retiring early. So it exacerbated the shortage. It made the remaining doctors less efficient. And we warned at that time, seeing that coming, that was going to happen. And we always looked to Canada and said, this is crazy. When I started, I could get a patient in for a needed medical procedure in 24 to 48 hours. Canada was looking at 6 months. Well, Canada's gotten worse, but so have we. We've approached Canada because of this issue. Now, in the state of Michigan, in a recent article, it showed that the average wait time to see a gastroenterologist, a stomach doctor, is 204 days. And I'm telling you, practicing in the Detroit metro area, that's probably not off. We have people who are bleeding and will call up the GI doc. And it used to, if I called, they'd get them in. Now we call and they say, 3 months for a colonoscopy. I say, but they're bleeding. They say, in that case, 2 months. And it's like, wait a second. This is dangerous to this patient. What happens if they're unstable? Well, you just got to send them to the ER. So what do we see in the ERs? ERs are overwhelmed because things that we used to be able to easily handle as outpatient are now becoming emergent, because the only way they can get care urgently is through the ER. And now you have stories of people literally sitting on gurneys for a matter of days in ERs. And ERs are not equipped to manage patients long-term like that. So now they're forgetting to give them the heart failure meds. So now they go to the ER and they're sitting on a gurney for something that could have been done outpatient. They're not getting their heart failure medications, and they're going into heart failure while sitting in an ER. So it's a calamitous, and it's hard to say, well, how can you link all that back to Obamacare? But I hope, in a bizarre stream of consciousness that I just gave you, that hopefully explain how that is actually all interconnected. How we pay for it has destroyed our system. And I mentioned Canada has gotten worse in that same time frame. So they've gone from 6 months to sometimes years to see a specialist. And this is not just inconvenience. This is death. And years ago, I had a patient, and I hope Americans never adopt this mentality, who came over from Canada, and we were talking about this issue. And she goes, we were talking about how hard it is to get MRIs in Canada. And she goes, oh yeah, I had an uncle who died from waiting for an MRI. They thought that he had a tumor. He had to wait 6 months. Turns out finally when he got it, yes, he had the tumor. It had widely metastasized at that time. It may have been treatable in that early stage, but by the time he got the test, it was incurable, and he likely died from it. And I said, oh boy, that's terrible. And she goes, no. We understand that there's limited resources, and not everything can go around. Everybody can get everything that they want. To which I responded, oh my gosh, that's terrible. But I wasn't referring necessarily just to the uncle's death, though that was. I was referring to her tacit acceptance of it.
Right.
And I pray Americans never accept mediocrity, because if they do, that is all we will ever get. Again, it's okay to expect a lot from your doctors. Is that always easy for us as doctors and providers? No, it's not. But you pay the American consumer, the American healthcare consumer should always have high expectations for the system, because if they don't, they'll get what they expect. And in that case, it's terrible mediocrity, suffering, and death.
Well, I can tell you that whether Americans believe it or not, they are consumers of healthcare in other areas where there's not insurance. Let's start with orthodontia. When my kids went through braces, guess what we did? We went to multiple orthodontists to find the best price with the best quality service, and the most follow-up, because I didn't have orthodontic coverage in my insurance plan. There is free market, and we are consumers when we have anything greater than a cavity at the dentist, because I don't know about you, but I've never had any coverage on anything past the cavities. So if you need a root canal, good luck. You better call around, because you will get very, very different pricing from different dentists or those types of doctors that do the root canal, all over the map. Plastic surgery is another one. You will get very different pricing on different procedures if you call around. You will also get different pricing on eye procedures, the LASIK surgery, which has been around for probably more than 20 years at this point. Do you know why? Do you know how good the technology is from 20 years ago? It's amazing. The healing time, everything like that. Do you know how much less expensive it is now than it was 20 years ago? Only wealthy people could afford it because it wasn't covered by insurance. It's still not covered by insurance. But now the technology is so good. The procedures are so good. The healing time is so fast. And the price is affordable to most anybody who wants to get it done.
Yeah, it's amazing what happens when you let innovators innovate. So they see a demand, and they can innovate to do that. When you have that set pricing system, like that occurs in the AMA and healthcare, as I described earlier, one thing that stymies is innovation, because the only way to get it paid for is to have a code for it. So anything new, there's a great disincentive for even creating it, because it won't get reimbursed. And that's why you see places like Soviet Russia had terrible innovation, was greatly usurped by the West, because they had to go through a massive process, and the person who had to bear the responsibility of creating the innovation would never derive a benefit from having exerted all that effort. Well, it is okay for people to gain wealth from making life better for people. Steve Jobs, when he was alive, he truly transformed the world. Was he wealthy from it? Sure. But he literally altered the course of human history. So when, and people, if they wouldn't buy it, if they didn't find they had a benefit, I not only bought, they didn't have to force me to buy my cell phone. I ran out and readily, doled out my money for it, because I knew I'd be better off for having it. Healthcare should be in the same way. There should not be mandates in healthcare. I'm glad to see that the previous one for ACA was repealed, because if you have to force someone to buy a product, it means it's probably not worth it.
That's a great way to look at it. Where can people go to find out more about you and your practice, and more about direct primary care in general?
Sure. So I'm on X. So if you look up Chad Savage, MD, you'll probably find me on X. Our website is yourchoicedirectcare.com, but that's specific to my own practice. There are places like dpcfrontier.net, I believe, or com. I'm not sure which one it is. Try them both. They have what's called a DPC mapper. And so they have a map of the United States. Nothing's all inclusive. So there's no, because we are a bunch of independent practices, they don't all participate in that, but that's a good way to find out if there's a DPC practice in your area. Look at their website, interview the doctor, find out if they fit your needs. And hopefully with some changes in DC occur, it'll be very clear that you can use HSAs for us. So if you take that already affordable membership price and can essentially reduce it by your tax rate, that makes it even more affordable. And the hope is that insurance products that carve out primary care and allow you to get it through just direct purchasing, like direct primary care, would make those coverage products dramatically cheaper too. So it would actually be better care at a lower price, which seems like outlandish thing to claim. But when you realize how broken the current system is, it's not hard to improve on both those fronts.
Right, exactly. Well, thank you for all you do. Thank you for the time you've given us today and talking about direct primary care. I'm a huge advocate of direct primary care, and I understand and have benefited from it. So if anybody wants to find out about direct primary care, please go online and search for it in your area. You will find organizations that have lists of doctors in your areas who do direct primary care, and it is a wonderful system to be part of. So Dr. Savage, thank you so much for taking the time to join us on Main Street Matters, America's small business megaphone. And thank you all for taking the time to tune in. Main Street Matters is part of the Salem Podcast Network. New episodes debut every Wednesday and Friday. You can subscribe to the show at salempodcastnetwork.com or wherever you get your podcast from. We'll be back soon with another episode. Bye for now.